commemoration for His Excellency Abdulrahman Abdulrazaq's 2 years in office, we can categorically say that his rating has been over 100%, I must say, because we least expect a lot of things that has happened in a very short period of time. The first thing that came to bear was when he first came in, there were arrears that we owed to hospitals by virtue of the interest that were paid to them to run hospital services. And we were very surprised when he made a payment of over 2.5 months arrears. That was the start of it. And then subsequently, there's been a lot of service improvement. There's been a lot of process changes. That his leadership, his innovative leadership, has really helped us to achieve significantly. For instance, we manage, as you know, hospital management board manages the HR system of hospital services. Essentially, the capital projects and the capital expenditures sits under Ministry of Health, but hospital management regulates, manage, post, deploy staff, and also due to our monitoring and process changes, we are able to streamline healthcare services. Put that into context, a lot of our patients now have more confidence in our service delivery, and as a result of that, our performances has significantly increased. Before His Excellency the Governor Abdulrahman Abdulrazaq came on board, all we were making across the state hospital was barely about 20 million. So, but now we are making over 50 million in terms of revenue to the government. So out of the 53 million or 50 million odd, we have significantly increased IGR generation by more than 50% out of this money, and the rest goes to, of course, to the consumptions of drugs, consumables, and the laboratory reagents. Now, the issue around this is nothing but the fact that we have significantly improved our service delivery optimization. We have recruited more number of staff that are working for us, and because we know that we have a government that is proactive to health, all our healthcare workers too are working extremely hard to making sure that his mandate, the mandate of His Excellency Governor Abdulrahman Abdulrazaq, is met. Patient patronage has increased because our staff are now giving quality services. They are now more empathetic towards our patient. A lot of equipment that were formerly moribund are now into use. So a lot of it has really significantly changed the narrative of healthcare services. Recently, we've also actually embarked on the clustering to making sure that all hospitals across the state have a cluster zone. We've clustered all our services, and from there we are hoping that all the hospitals that are yet to be brought to standard, we're going to bring them up to the standard of secondary healthcare services. So if you go back to the question that you asked, to saying that how has His Excellency performed in 2 years, once I start now, I don't believe I will stop today, because it will go from one to the other. It's a ripple effect. One section, one service is strengthening the other, and then we have a ripple effect, and everything is having a multiplier effect in service delivery. So so it's a significant story to record. So in line with Governor Abdulrahman Abdulrazaq's commitment to healthcare in Kwara State as a whole, I honestly can't emphasize enough that the commitment in healthcare in this state, as far as I'm concerned, there has never been its kind. A lot of our counterpart funding was the first thing that His Excellency Abdulrahman Abdulrazaq did, that we had a lot of counterpart funding that was paid, and we then have a lot of funds and revenue that came into the state. And I'm sure you know 2020 gave us a very bad year from COVID, and it was, if not for the commitment of His Excellency towards healthcare, God knows how many people would have lost their lives. We were rated one of the third most prepared state for COVID-19, and of course we now have our moribund oxygen plant operational. We have a lot of our healthcare institutions, primary healthcare institutions, renovated. We have few of our secondary facilities renovated as well. We are having a 12-bedded ICU that's almost in completion. We now have an expansion for eye care services in the state. The dental services in the state is also having renovation currently going on. So it's a lot that is really happening currently. And if you look at all these service points, you see that one is actually helping the other. We have never, well, as far as I know, I have never seen healthcare so geared up, so active, so determined as we have it now. And what we are emphasizing is in the next 2 years, we're still going to see a lot more in healthcare. And coming to his second term in office, I believe Kwara State is going to then be a center of tourist center for medical tourists. It will definitely be a medical tourist center in Nigeria, because we have a lot in the pipeline. And I always say to a lot of our healthcare workers that anyone that is working for the state government, this is the best time. Anyone sitting on the fence is losing a lot, because one thing I know for sure is that we are looking at a way to actually improve welfare of our staff as well. And His Excellency Governor Abdulrahman Abdulrazaq is, we are working towards making sure that we improve welfare of our staff. We have recently recruited more healthcare workers. We are still going to do more. There's a lot of energy towards renovation of more secondary facilities, and His Excellency has really keyed into it. So we fixed Ogidi Cottage Hospital, Children's Hospital has been renovated. We are currently doing Lafiagi, General Hospital. Okuta General Hospital is also under renovation. So it's going to cut across all the 3 senatorial districts. Most importantly, it's not just to fix those hospitals. We're also looking to, in collaboration with His Excellency's vision, that we want to see how hospital equipment can, well be supplied to all these hospitals that have just been renovated. So, by and large, I believe for any health, for any nation, for any state to achieve any positive stride in terms of productivity, in terms of progress, healthcare comes first. Our people say health is wealth. A healthy state translates to a productive state. And part of His Excellency's mandate is to making sure that our people get the best healthcare services ever. So yes. So certainly, most definitely, for these 2 years, we have really achieved a lot. Another area that we have strengthened in the last 2 years is His Excellency Governor Abdulrahman Abdulrazaq, graciously approved for us to start the automation of human resource management. So this has allowed us to have a better management of staff distribution, staff strength, and a lot of other algorithm or other processes that we have put in place to to improve productivity of our staff. Recently, we've been able to find that there are a lot of repetition across some of the service areas and across some discipline that we are working towards, making sure we have closer look at every single staff, being able to also identify the fact that staff that are not on their duty post, we can hold them accountable. So this HR management software has allowed us to have a better control on how we can regulate people who are going to be retiring, people for promotion, and people going on annual leave and the like of it. So it's, in a way, is taking us away gradually from the paper-centered administrative processes to a more automated process. So these will in real time allow us in future to be able to to calculate with accuracy what we need in terms of staffing capacity, excesses that we have in our system, how we can strengthen productivity, and how to measure productivity and benchmark what we're actually generating in the state. So when we say generating, hospital service is a social service, but to some construct, it's important for us to understand that for staff to work within the state civil service, we must be able to have a tool to measure their productivity, to measure their performances, especially most importantly because it's healthcare. Healthcare is calculation driven, and everybody working within the healthcare framework understand the importance of numbers. We understand the importance of productivity. We understand the importance of a scientific justification for everything we do. So with the new system of HR, we are looking to build upon that. Currently, we are working on a business plan for hospital services in the state, to us to be able to have a 5-year plan for the state to see where we would be in 5 years' time when it comes to healthcare. So every aspect of our service delivery is currently being measured, is currently being assessed, is currently being evaluated. So we will be able to then extrapolate areas of weaknesses, and we will see areas where we want to strengthen in terms of quality services. So all these are constructs that is looking towards gearing the state and preparing the state for a center of clinical excellence. We want to then have an oncology center within the state. We're hoping to have a mega eye care center in the state. We're hoping to have, dentistry to be top notch in the North Central, and a lot of services like the dialysis. We have also been looking. We're purchasing 2 more dialysis machines, such that we can have a 24-hour services when it comes to dialysis services. We are looking to expand services with diabetic care. We are looking to expand services with cardiovascular issues and conditions, and see how we can strengthen referrals from all other services. We are looking to have a neuro center, and that's why we have a 12-bedded ICU. We're looking to have private amenities such that we can accommodate any type of patient group. The government institution is a public institution, but the better we get at, the better our patient will respect our services. The better we can have different clientele that will capture within it. We can begin to see that government intervention and government support for healthcare in country, Nigeria, should change the narrative. We should change the narrative of government-centered healthcare management services to a more public-private driven institution, such that more facilities can be provided, more services can be provided in hospitals, so that we can have better quality services, so that our staff can also see that the government of the day means business. So all this is a lot of package that we're trying to unravel, and we're trying to unpack, such that in the next 5 years, Kwara State is going to be seen as a reference point. Kwara State is going to be seen as a leader when it comes to healthcare services in this country. It is possible. It is indeed very, very possible that we can achieve that. And I believe before the end of the second tenure of His Excellency Governor Abdulrahman Abdulrazaq, we will have a healthcare system that is everything to write home about. Thank you. So, Hospital Management Board want to seize this opportunity to congratulate our amiable, our active governor, Governor Abdulrahman Abdulrazaq, for his dedication towards healthcare, for his commitment to the better healthcare for his people, for making healthcare to be accessible, affordable, and accessible. Okay, so we want to thank him for all his support for healthcare. We want to thank him for all his commitment to his people. We want to thank him most sincerely that he sees Kwara as a potential place for progress. And we cannot thank him enough from Hospital Management Board. Thank you.